the nicotine that will always cause interference in the measurement of analytes. It actually, anong rule natin sa smoke, sa nicotine? Ideally, basahin mo maigi yung question sa board exam. Ideally, 24 hours before the test. Maganda, no smoking. No without nicotine exposure. Or at least 8 hours before the test. At least 8 hours, okay? Otherwise, hindi sumunod si patient sa fasting. Ma'am, ibig mong sabihin si no smoking part of fasting. Fasting, non per orem, NPO, nothing by mouth. It includes cigarette. Take note, cigarette is included in NPO. Hindi ka dapat mag-smoke si patient. Kaya nga nothing by mouth. That is the meaning of NPO, non per orem in English, nothing by mouth. At ideally 24 hours before the test or at least 8 hours. Ma'am, hindi sumunod si patient. Nag-smoke pa din. Within 8 hours of supposed to be fasting, it includes smoking. Take note, no smoking. Increase si catecholamines, si cortisol, at saka si growth hormone. Tanong, ano ba yung tatlo na yan? Ano ba yung tatlong hormones na yan? Ladies and gentlemen, these are the hyperglycemic hormones. Do not forget that. These are the hyperglycemic hormones. So what happened? Nicotine triggers the release of these hyperglycemic hormones. Of course, from the endocrine glands to the blood circulation. Ay, syempre, hyperglycemic hormones yan. O, ano mangyayari sa glucose concentration? Di increase. Pati si cholesterol, pati si triglyceride, pati si urea. Kaya I'm sure sasabihin mo to, Ma'am, kaya pala ikaw mag-anak incorporate ko na may diabetes mellitus, ma'am. Ang sabi ng doctor, you have to cut the stick. Stop smoking because that will lead to increased blood glucose. Correct? It is because of the release of the hyperglycemic hormones. What else? Ammonia is very much affected by nicotine. Why? Tingnan mo guys, ang increase ng ammonia, 100 to 200 microgram per liter every cigar. Ganyan kataas ang ammonia. Ibig mo sabihin, ma'am, pag ammonia, dapat din no smoking, ideally 24 hours before the test. Ay, syempre. Or at least 8 hours before sample collection. Of course, because again, no smoking is included in non per orem or fasting or nothing by mouth. Take note. Ma'am, halimbawa na expose si patient. Tandaan mo guys, magsasample collection ka. Pumasok ka sa room ng patient, private room. Nako, amoy nicotine. Nakita mo yung request ng patient, ammonia. Ano agad na sa mindset mo? Oh my God, the patient was exposed to nicotine. Tatanungin mo pa rin yung patient, Ma'am, your sample collection, your test written on the requisition form is ammonia. Okay, sabi ni patient. Ma'am, sabi mo sa patient, Ma'am, your room is obviously, evidently, with nicotine exposure. Sasabihin ni patient, nako, hindi ako nag-smoke, yung aking visitor, yung dumalaw daw sa kanya. Or second, naku, ako ang nag-smoke, na-stress kasi ako, so nag-smoking na lang ako sa room ko. Oops, ano sasabihin mo sa patient? Naku, ma'am, hindi mo pwede kayong kuhanan ng blood. Because, number one reason, you were exposed. Either, nag-cigarette smoking po kayo, or it was your visitor. So kahit hindi siya yung nag-smoke, but the patient was exposed. Take note. So what happened? That is still false increase of ammonia. So what is the next instruction to patient? Ma'am, the sample collection will be tomorrow. And before sample collection, you have to take a bath. You have to wash your body, soap and water, and make sure to change your clothes. And ideally, the sample collection should not be in your room. You should go down and move to the laboratory. Doon siya kukuhanan ng blood. Sasabihin ni patient, bakit? Because your room is still exposed to nicotine, even next day. So, ano sasabihin mo sa patient? Sample collection should be tomorrow. Take a bath, change clothes, and since your room is exposed to nicotine, you have to go down and sample collection will be in the laboratory. Next rule in ammonia test, nako si phlebotomist. Kung si phlebotomist po nag-smoking, ma'am, bawal siyang mag-sample collection. Si phlebotomist nag-break, nag-smoking, nako nakita niya, God, the next patient, ammonia test. Ano sasabihin na naman ni patient? Ni phlebotomist, I should not draw blood. Bakit? Kasi yung nicotine po ay nasa hair niya, nasa clothes niya, nasa skin niya. Mag-gloves naman po si phlebotomist before sample collection. Kahit mag-gloves siya, kasi nasa hair niya, nasa clothes niya. So paglapit niya doon sa patient, yung nicotine fiber sa katawan niya, sa clothes niya, sa hair niya, sa skin niya, ano mangyayari? Mapupunta doon sa arm ng patient. Easily, children. Kaya pag may nakatabi kang nag-smoke, hindi ikaw nag-smoke ha, nakatabi mo lang, nag-aabang ka ng taxi or grab, sabi mo, pag-uwi mo sa bahay, bakit parang may cigarette na ako? Kasi yung negative fiber niya, nalilipat sa'yo through air. No smoking na si patient, no smoking pa si phlebotomist. What is the only patient preparation in chemistry that the phlebotomist is part of the patient preparation, part of the patient preparation? That is the ammonia test. Take note, no smoking. What else? Smoking also affects the body's immune response. Increase IgE, low IgA, IgG, and IgM. Take note of that. We have the low IgA, the IgG, and the IgM. These are antibodies. Okay? What else? And how about alcohol ingestion? Well, ideally 24 hours before sample collection. Ay, syempre without alcohol intake. Mom, yung patient alcoholic. O, sige. At least 8 hours before sample collection. So you mean, mom, the smoking and the alcohol intake, part of the non-per orem, nothing by mouth. It's not only water. It's not only food. Of course. That non-per orem is nothing by mouth. Okay? So, ang tanong, ma'am, pasaway si patient. Sinabi na nga po mag-fasting at least 8 hours. At least 8 hours. Naku, hindi pa rin sumunod si patient, ma'am. Tandaan mo si alcohol intake. Ideally, 24 hours before sample collection. No alcohol intake. O sige, ayaw. Hindi kaya ng pasyente. O, edi doon na lang. 8 to 12 hours or at least 8 hours. Hindi pa rin sumunod si patient. iPhones increase, triglyceride, urate, GGT. What is urate? Uric acid. What is GGT? Gamma glutamyl transferase. Ma'am, ano yan? Oh, gamma glutamyl transferase. Ladies and gentlemen, imposibleng hindi mo alam yan. Kaya sasabihin ko sa iyo ulit, guys, this is a review. Ano ibig sabihin ng review? This is a measure of your understanding. Ano ang natutunan mo for 4 years? Clinical chemistry, 3rd year. Clinical chemistry, MTOP. Clinical chemistry, seminar classes. Ano ang natutunan mo? Pag sinabi mo sa akin, ma'am, hindi ko kilala si GGT, that is a big question mark. Because this is an alcohol-sensitive enzyme. All the professors of clinical chemistry, parating tinuturo sa'yo yan. Ang tanong ay bakit hindi mo siya naalala? Kaya uulitin ko, guys, ang sinabi ko sa'yo, Nung ikaw ay galing sa online class, blended ang learning mo. May on-site, may online. That's why this is a measure. How did you perform during online classes? Bakit? Kasi ang exam mo po ay on-site. Gamma glutamyl transferase is GGT. This is an alcohol-sensitive enzyme. Anong ibig sabihin po nun? Anyone, anybody, everybody, okay, who will take alcohol, first time or end time, kahit first time, ma'am, tumikim lang naman, ma'am, hindi naman po siya talaga uminom ng alcohol, just a taste, just a sip. Ay, kahit na just a taste yan. GGT will automatically take note, increased in plasma because it is an alcohol-sensitive enzyme. Huwag mo kakalimutan yan. What is the marker for alcoholism? Because that is always increased. What is the answer? GGT. Anong result sa glucose? Well, kapag may glucose test po, it includes no smoking, no alcohol intake. What is the effect of alcohol to plasma glucose? Especially chronic alcoholism, decrease. Stress. Ay, naku, alam ko sinabi ng parents mo yan. Uy, alam mo ba, meron akong sabi ng parents mo, meron akong executive check-up. O sige, ano ang executive check-up? Remember that stress normally increases Catecholamines, cortisol, and ACTH, adrenocorticotropic hormone. Ang tanong, ano naman po yung tatlong hormones na yan, children? Oh, they are the stress hormones. These are examples of stress hormones. Bakit sila tinawag na stress hormones? Because lahat po tayo ay naka-experience ng stress. Ano mangyayari pag na-stress tayo? Tumataas po ang hyperglycemic hormones. And what are the hyperglycemic hormones? Catecholamines, the cortisol, and ACTH. Unfortunately, they are also stress hormones. Ay, kaya pala sabi ng parents ko, ma'am, tumaas daw po ang kanyang blood glucose because of stress. Yes, because of stress hormones, which are released automatically during periods of stress. At ano mangyayari pag na-release yung tatlong yan, children? Ay, walang kaduda-duda. That will promote hyperglycemia. Take note that will definitely promote hyperglycemia. Also, the increase of prolactin and albumin. Oh my God. What else? How about drugs? Ay, syempre, matagal na nating alam. Ano ba ito sa ascorbic acid? Ascorbic acid affects oxidation, reduction, reactions. What else? And opiates, do not forget. Opiates cause increase in liver and pancreatic enzymes. Okay, it causes increase in liver and pancreatic enzymes. Opiates are prohibited drugs. Okay, guys, alam naman natin ang prohibited drugs. They are toxic. Ano ba unang sinisira ng prohibited drug? Syempre, the organ for detoxification. Unfortunately, there is one organ inside your body, baka nakalimutan mo, children, ha? There's one organ inside your body wherein one of the main functions is to detoxify. And what is that organ? Liver. Ang tanong, mom, organ for detoxification pala si liver. Eh, bakit siya nasisira pag mayroong mga toxic substances inside the body? Eh, hindi kinaya ng liver. And pancreas is also, take note, destroyed due to intake of, one of the causes, due to intake of prohibited drugs. Okay, what else? And how about sample collection and handling? Let's have a brief review of sample collection and handling. So this is after patient preparation. Exercise, fasting, prolonged tourniquet application, diet, of smoking, ideally no smoking 24 hours before the test or at least 8 hours. Alcohol ingestion, no alcohol ingested at least 8 hours. And we have the stress hormones, do not forget. And drugs could definitely affect results in chemistry. This is why sometimes it has to be noted. The phlebotomist will ask, ma'am, did you take any other therapeutic drug within the 8-hour fasting, within the 12-hour fasting? Pag sinabing yes, okay, sulat niya. Sabihin mo, isusulat na dun sa requisition form. That is so important. Specimen collection and handling. Of course, proper patient identification is always the first step in sample collection. How do we identify patients? International guidelines and most healthcare organizations require at least 3 identifiers to confirm patient identification. Before we draw sample, make sure that the patient's complete name is written on the requisition form. And the patient's complete name on the requisition form should match the name that will be uttered by patients. So pag sinabi ng patient, good morning, ma'am. I'm from the clinical laboratory. There is a request here from your physician. Will you please state your complete name, including your middle name? Do not forget that if that will be asked in lab management, the complete name includes the first name, the middle name, and the surname. Middle name means the surname of your mother. Take note. And the birth date is so important, and the patient ID. If the patient is an inpatient, you have to check the hospital ID number of the patient or the patient record number. Ma'am, paano kung si patient outpatient? Oh, you have to ask patient for a government ID. Yun ang madalas nire-request sa mga hospitals globally. The government ID is the third patient identifier. That is for outpatient. Take note. Ma'am, may mga hospitals ba with outpatient number? Wala. Kasi ang meron talagang consistent hospital ID number, yung inpatient. Okay? What else? And take note also that page 42, ay naku, kahit hindi mo na nga ito, those who do not have handbook, ay kahit hindi mo na isulat to, what are the sites for venipuncture? Of course, the most common site is the antecubital fossa region. Okay, the antecubital fossa region. And what is the best site? The median cubital vein, because it is the most anchored vein, almost not movable vein. Yan talaga ang best site natin, the median cubital vein. That is one of the veins in the antecubital fossa region. Ops, ang tanong, what is next to the median cubital vein? Halimbawa, multi-puncture na po si median cubital vein. Ay, syempre, ano susunod natin? Cephalic vein. And what is the third in the antecubital fossa region? The basilic vein. Third choice yun. Because the basilic vein is so close to the brachial artery. Kaya subukan mo ngayon. Subukan mo i-check yung iyong basilic vein. Ay, parang bakit may pulse? Ay kasing halos katabi siya, children. Hindi pala halos, katabi talaga siya ni basilic vein. So it is the third choice because of the closeness to the brachial artery. The basilic vein is so close to the brachial artery. Okay? Then, ma'am, di na pwede si antecubital fossa region. Hindi na pwede si median, multi-puncture na si cephalic, multi-puncture na si basilic vein. So what is the third choice? Well, you have the dorsal vein. You have the wrist vein. Una muna si wrist. This is the fourth. The wrist vein, the dorsal vein, and the veins in the ankle area. Last yon, kasi nga, we should only consider the ankle veins among patients, guys, which are non-DM. No? Ang ankle veins ay para lang sa mga pasyente na non-diabetes mellitus. What else? Then, kasasabi ko lang sa iyo, may median, may cephalic, at saka may basilic vein. This is the antecubital fossa region. What else? And make sure that you have to use gloves. Hindi na kailangan i-emphasize siya. Noong pre-pandemic, medyo nagtatalo-talo pa siya. Kailangan ba naka-gloves pa? Each patient. Children, let me remind you. Some exam, you have to change your gloves after each patient. And make sure that the tourniquet is also sterile each patient. Mom, are you saying each patient one tourniquet? Yeah. And you have to dispose the tourniquet after using it together with the gloves. Each patient, you have to dispose the gloves and the tourniquet. Of course. Noong pre-pandemic, pinagtatalunan pa yan. Ayaw pa sumunod ng iba. And nag-pandemic na. Ay, wala, ikaw ba papayag ka yung gloves na ginamit ng phlebotomy sa patient A, gagamitin kay patient B? Of course, not shock. We don't need to explain that. Even the tourniquet, kasi nagkaroon ng contact sa skin. Ay, sa patient A, gagamitin sa patient B. Hindi ako papayag. No, that's why it should be all disposals. Okay? What else? What is this handy instrument, children? Hinahawakan ni phlebotomist. Handy. That is a vein viewer. Ay, kaya pala bang napansin ko, parang in fairness, parang nakikita ko yung veins niya. Tama. This is the median cubital vein. Ito median to. And this is your basilic vein because close to the inner arm. Okay? What else? Ops, ma'am, anong importance niyan? Remember that this is actually infrared light. And ang tanong, ma'am, bakit naging visible yung vein? Hemoglobin in the blood. Hemoglobin in the blood. My goodness gracious. Within the veins, absorbs the light. Ma'am, ano po yung nag-absorb ng light? Yung hemoglobin. Hemoglobin in the blood, within the veins, absorbs the light, causing the veins to stand out as dark lines. Take note of that. Ibig mo sabihin, ma'am, kaya naging prominent yung vein na yan because the hemoglobin within this vein absorbs this infrared light. Correct. Do not forget. Ma'am, bakit parang may arrow ka dyan? Ay, syempre, tatandaan mo sa board exam. Mayroon siyang standard distance to achieve the real-time size of the vein. Pag sabing real-time, Ma'am, yan ba talaga yung size ng vein? Ay, oo. Make sure that this vein viewer is 7 inches over the phlebotomy site. Pag sobra naman layo, more than 7 inches, ay ang nipis naman masyado ng vein. Pag sobra naman lapit, ang enlarge naman ng vein. O, yung, sa sobrang enlarge, pag na-insert ka ng needle, ay, hindi ko pala na-hit yung vein. That's why it should be 7 inches only over the phlebotomy site to really achieve the real-time size of the vein. Do not forget. Take a photo, please, guys. Yan lang ang sinabi ko sa yung take a photo, ha. Nagkakaintindihan tayo dito, guys. Okay? What else? And how about page 44? Notes to remember. Ma'am, pati tourniquet application dapat namin tandaan. Mas gusto ko nang itanong sa'yo si tourniquet application kaysa mag-compute ka ng coefficient of variation. May stress ka nun. Remember, children, there is a standard distance of the tourniquet over the site of puncture. It should be 3 to 4 inches above the site. Ma'am, bakit ine-emphasize po yun ng CLSI, Clinical and Laboratory Standards Institute? Eh kasi naman, kasi iba naman ng tourniquet, nasa siko na, nandito na mismo sa greases ng forearm. It should be 3 to 4 inches above the site. Ma'am, pag sobrang lapit, that may cause lysis of red cells. Take note. Kaya pag nag-draw ka ng sample, perfect naman yung sample collection. Kaya bakit hemolyze yung blood? Isipin mo kung paano ka nag-sample collection. Ay, masyadong malapit yung tourniquet. And it should be less than 1 minute. Naku, pinaliwanag ko na sa iyo yan. Otherwise, there is hemo concentration. What else? And, ma'am, naiwan ko po yung tourniquet ko sa laboratory. Can I use the BP cuff? Di ba guys, may mga patients, no? Lalo na sa intensive care unit, critical care unit, yung BP cuff, naka-on yan, hindi tinatanggal yan sila, nakakabit sa arm ng patient. Ma'am, can we use that as an alternate tourniquet? Provided you inflated 60 millimeter mercury. Okay, you can use. Huwag mong kalilimutan yan. Sabi nila, hindi ako nagsasabi, ha. Tinanong yan sa board exam, panalo talaga. Ano daw po yung pressure ng blood pressure cuff? Okay, you should inflate it at what millimeter mercury? 60. To make it an alternate tourniquet. What else? Page 44. Well, according to the CLSI, anong sinabi niya? When a tourniquet is used during preliminary vein selection, it should be released and reapplied after 2 minutes. Ma'am, bakit ina-emphasize ko yan? Children, because you really have to release it. When you apply tourniquet the first time, we call that preliminary vein selection. You're actually searching for the vein. Ma'am, na-locate ko na. Then you have to release the tourniquet. Get your alcohol pad, then you have to Unsepticize the site for sample collection, and make sure that you allow the alcohol to evaporate. Best is you allow the alcohol to evaporate rather than getting a sterile cotton ball and you wipe the excess alcohol. That is just secondary instruction. What is the first instruction and the best instruction to ensure complete antisepsis? You allow the alcohol to evaporate because sometimes the cotton, children, is contaminated with spores. Tandaan yan, people. So, sabi ng CLSI, to achieve complete antisepsis, you allow the alcohol to evaporate. Oops, while waiting the alcohol to evaporate, get your tube, get your needle, get your adapter, get your wound plaster. Yun ang uso ngayon, guys, wound plaster, parang band-aid, wound plaster, prepare it. Or if you do not have such, get your gauze pad and micropore, post it on the skin of the patient with less hair, not on your skin. Hindi po dinidikit yung micropore with gauze pad. Ma'am, bakit gauze pad? Hindi po dapat cotton. Ay, hindi na po allowed ang cotton. Dumidikit siya sa wound ng patient. Kaya pag hinila yung cotton, nagkakasugat yung patient. So that's what is the recommendation? Gauze pad. If you do not have the wound plaster, then use a gauze pad, guys, with micropore. Post it on the skin of the patient with less hair. Hindi dito sa table, hindi Hindi sa table, hindi sa warding box, at lalong hindi sa skin of phlebotomist, doon sa skin ng patient. Why? Because we have MRSA. Di ba? Eh kung may MRSA ka, dinikit mo sa skin mo. Pag nasa ka mo dinikit mo sa skin ng patient, Jurassic Park. Okay? Mom, hindi po pwede sa table. That is incorrect. Alam niyo, children, pag ako ang pasyente sa hospital, naku, si Dr. Rodriguez, walang gusto mag-sample collection sa akin para daw lagi practical exam. Okay? Kasi hindi ka pwede dito sa skin, contaminated. Hindi pwede sa table, idikit mo yung plaster, contaminated to. Tapos nalalagay mo sa skin ng patient, bawal. Doon ka magdikit sa skin ng patient. If you're using the micropore and gauze pad. Hindi ko na kailangan ipaliwanag paano nangyari yan. Eh kasi meron tayong, there are patients, there are individuals, they are unaware that they have methicillin-resistant Staphylococcus aureus, causing antibiotic resistance. Pwedeng matransmit through tourniquet. That's the reason the tourniquet should be disposable. Take note. Mom, can I demand, halimbawa ako yung patient, I noticed that the tourniquet that was used for 2 patients will also be the same tourniquet that will be used for me because I'm the 3rd patient. Pwede, can I demand to change the tourniquet? Yes, but when you do it, please, with due respect. Excuse me, Madam Phlebotomist, Sir Phlebotomist, do you have another tourniquet? Because you see, it should be disposable. You should say it in a very respectful way. Kasi dapat palitan. Oops! Sinabi ko na sa iyo yan, ha? Allow the alcohol to evaporate to achieve complete antisepsis, and not only that, because traces of alcohol may cause hemolysis. Pag pumasok po yung alcohol na yan sa iyong needle, dire-diretso na yan sa tube mo, yung susunod na blood ay malalays. Take note. Benzalkonium chloride is the best skin cleanser for ethanol test. Ma'am, ibig mo po sabihin, sa dalilan children, pasensya na children, the mother should give instruction to the son. Okay. Ma'am, ibig mo sabihin yung anak mo, ma'am, nandiyan pa sa bed mo, ang tanda-tanda na. Well, if there is a visitor in his room, their golden rule in the house, then if you have a visitor, that visitor will sleep in your room and you will sleep beside mommy. No choice. Amazing. And I asked him, Gab, I have a lecture, you have to rise up. Mommy, your bed is so nice. I want to have a bed like this because my bed is an orthopedic bed for the orthopedic individual. Going back, sa pasensya na guys sa mga interruption, because we are doing classes online. Eto ha, Ma'am Edith and Ma'am Jo and Sir Ryan, may nakarating sa aking request, may nagre-request, may nag-comment daw, Sir Ryan. Are you there already, sir? Bakit si Dr. Rodriguez hindi siya on-site lecture? Kasi daw they are waiting for me na on-site. Totoo ba yun, guys? Tignan, totoo ba to 120 students? O 118? Totoo ba ang nakarating sa aking balita the other week na bakit daw si Dr. Rodriguez ay hindi on-site? And they would like to see me on-site. At magpapapirma pa daw ng libro dahil nga yan ang nakikita nila sa Instagram, etc. etc. Huwag kayong magkalala pagdating ng pre-board, on-site ako. Huwag kayong magtatampo sa susunod na batch, mag-on-site ako kasi talagang due to insistent public demand. O sige na, walang problema. Balik tayo sa benzalkonium chloride. So going back, ma'am, ibig sabihin po, pag ethanol test, the skin cleanser should not be 70% alcohol. Check. Not even 40% alcohol, check. It should be an alcohol-free skin cleanser. And what is an example of alcohol-free skin cleanser? Benzalconium chloride. Ma'am, paano pag si hospital walang benzalconium chloride? Ayun na si patient. May dala-dalang request. Ang nakalagay ethanol test, methanol test, or any other alcohol test. What is alternate to benzalconium chloride? Simply soap and water. Sasabihin ni phlebotomist doon sa patient, ma'am, we have a lavatory over there. You have to bring this soap dispenser. Ay, syempre, hindi bar soap, ha? Hindi pwedeng bar soap, sinishare ng mga pasyente. It should be liquid soap. This is the liquid soap, ma'am. You have to bring this, and there is a laboratory, and I will observe you how you will wash the antecubital fossa region because that is the site for puncture. Make sure, ma'am, to wash it thoroughly with soap and water. Children, the soap should be alcohol-free. That is also a requirement. Ma'am, paano kung may alcohol po yung skin cleanser? Paano kung meron pong alcohol yung soap? Ay, syempre, children, di nandito siya sa skin ng patient kahit madry yan. So when you insert the needle, ay syempre magkakaroon ng trauma yung skin. What happened? Lalabas ang tissue juices. What happened? Pwede sasama yun sa needle mo. Pwede yung tissue juice mo may alcohol. Pwede yung blood that will come after the tissue juice. What happened? It's already contaminated with alcohol. So that is false increase. Next, insert the needle bevel up 15 to 30 degree angle. Take note, 15 to 30 degree angle. Oh my goodness gracious, great balls of fire. Yung mga may book, nandyan yan chlorhexidine gluconate. You don't need to copy that. Chlorhexidine gluconate is the recommended skin disinfectant for blood culture, especially for infants 2 months and older. Copy it. Those who do not have book, copy that, guys. 2 months and older, and patients with iodine sensitivity. And patients with iodine sensitivity across age. Ma'am, 52-year-old na po yung patient. Meron pong iodine sensitivity. Betadine is the brand name. Tandaan natin sa blood culture. Guys, sa blood culture. Ay, dalawa po ang disinfectant. Meron kang iodine, that is the povidone iodine. And then we have the 70% alcohol. Do not forget that. Ay, ma'am, may allergy po si patient sa iodine. What is the alternate for iodine? Chlorhexidine gluconate. For infants 2 months and older, chlorhexidine gluconate. Ang tanong, ma'am, nakalagay dyan 2 months and older. Paano kung less than 2 months? Meron pa rin sinabi si CLSI. In patients less than 2 months of age, chlorhexidine should not be used. Instead, use alcohol swab. Ma'am, pag 2 months and older, ang recommendation na chlorhexidine gluconate. Yes. And also for individuals with iodine sensitivity. Yes. Next question. Ma'am, how about for infants less than 2 months? Alcohol swab is best. 70% alcohol. Ma'am, bakit hindi pwedeng chlorhexidine? Because there were studies that for infants less than 2 months, there is a skin reaction when you apply chlorhexidine. Kaya ma'am, ang gagamitin pa rin, alcohol swab. Correct, 70% alcohol. What else, guys? And it should be inserted the needle, 15 to 30 degree angle. What else? And meron ka rin makikita, guys, na alcohol pad na may handle. Para hindi mo hahawakan yung pad, meron ng handle, yung alcohol pad. Amazing. Especially for blood culture. Remember the 3 to 4 inches above the site. Tourniquet application. What else, guys? And eto you have to take photo after ipakita ko lahat. Everybody, those with and without books, okay? Other sources of contamination causing pseudobacteremia. 1. IV catheters and various skin disinfectant solutions. Take note here, guys. There was a study saying that the benzalconium chloride is occasionally contaminated with Burkholderia cepacia and Enterobacter species. In other words, IV catheters and various skin disinfectant solutions. Ma'am, that includes betadine and alcohol, check. May be contaminated with Burkholderia cepacia and Enterobacter species. Nakalagay pa dito, povidone iodine. There were studies conducted They found out it is contaminated with Burkholderia cepacia. So are you saying, ma'am, that Burkholderia cepacia can contaminate povidone iodine? Check. Can contaminate benzalkonium chloride? Check. What else? And even evacuated tubes, guys, may be contaminated with Serratia marcescens and Moraxella species, causing pseudobacteremia. Huwag mong kalilimutan yan. Take a photo, guys. Okay, everyone. That's important. Benzalkonium chloride and povidone iodine. And even Serratia marcescens for collection tubes. How about page 42? So, mom, it's already 2022. Do we have a new order of draw? Wala. In fact, when I check the McPherson and Pincus 2022 edition of John Bernard Henry book, Clinical Laboratory Management by Laboratory Methods, take note, pareho pa rin po ang order of draw. Kaya lang, meron ako sa yung i-explain maya-maya. Because if you're going to check the 2022 edition, I'm sorry, the 24th edition or the 2022 copyright of John Bernard Henry, merong doon medyo dapat ipaliwanag ang mga professors. At ano yun? Ipapaliwanag ko ngayon. First, according to the reference book, hindi natin pwedeng buruhin yan, hindi natin pwedeng buruhin. Ano nakalagay sa reference book? Still, the first order of draw is yellow top. Ang nakalagay pa rin, yellow top. Ang tanong, ma'am, ibig mo sabihin, ang cup ng blood culture bottle, yellow lang ang color, walang blue, walang green, walang orange, walang pink. Ay, meron. Children, I am very certain it was explained in clinical bacteriology discussion na kung wala ka pang microbiology, abangan mo yung lecture na yan. Hindi ka takatakan tanungin sa board exam yan. What is the color of the cup of the blood culture bottles? Mom, why do we have to remember the color of the cups of blood culture bottles? Because the color of the cups will tell you the organism that should be isolated. Ay, may green, may blue, may orange, may pink. Naku, iba-iba yan, children. Eh, bakit dito mo nakalagay yellow top? Kasi meron ding yellow top. Meron din yellow cup. That is the reason why, if you are going to check the CLSI website, ano nakalagay na sa order of draw ng CLSI website? Just plain blood culture bottle without a corresponding color. So, mom, paano po kami nyo pag tinanong kami sa board exam? Relax. Tatanungin ka sa exam. In the order of draw, which of the following choices is the first draw? Guys, di ba sinabi ko na sa iyo ng first day ng lecture, gusto mo talagang mag-top sa board exam? Kayang-kaya mo. How you will do it? You are going to answer all the multiple choice questions, MCQs, pre-test, post-test, pre-board, lahat ng binili mong books, na review books for the those with Q&As, question and answers, review books for this board exam. You're going to answer all the questions without looking at the choices. Gusto ko talaga mag-top sa board, you're going to answer questions without looking at those choices. Bakit? Because if you can answer questions without looking at these choices, top 1 ka na. Wala pa choices, alam mo na yung answer. Hindi ka pa humingi ng hint. Yan ang gagawin mo simula ngayon. Ma'am, ayoko mag-top notcher pero gusto ko lang maging RMT. Ganun pa rin ang gagawin mo. Kasi you have to gauge yourself before the board exam that you can answer questions without choices. So nakita mo, which of the following choices is the first draw in the order of draw? Ano ang ine-expect mong nasa choices? Dalawa. Meron ka makikitang yellow top. Ano pang pangalawang ine-expect mo sa choices? Walang yellow top, pero ang nakalagay, blood culture bottle. Walang yellow top, walang blood culture bottle. Anong sabi ng CLSI? A special test tube or a special blood bottle. Ma'am, ibig mo sabihin, special tube, special blood bottle. It means that is also for blood culture. Correct. Yan po ang sinabi ng CLSI. Huwag mong kalilimutan yan. Ma'am, bakit nakalagay sa'yo dyan yellow top? Yan ang sinabi ni John Bernard Henry book. Wala po tayo magagawa because that is the reference book in our licensure examination. Ano pa rin ang nakalagay sa copyright 2022? Yellow top. Let me remind you, it's not the only cup if we're talking about blood culture bottles. Light blue top is citrate. That is for coagulation studies. That is the second. The third order is based on the purpose of the tube and not based on the color of the tube. If you will tell me, Mom, bakit ng third year ang itinuro po sa amin yellow type, light blue, and red? Kailan ka ng third year? Tignan mo yung eyes ko. Kailan ka ng, Ma'am, matagal na po akong graduate. Baka meron dito nakasit down, matagal ng graduate. 15 years ago. 15 years ago, baka based on color pa yon. Pero po ngayon, matagal na, 2003 pa po nagsimula yan. If my memory serves me right, it is now based on the purpose of the tube, the third row. What is that? Serum tube. There is a description. A serum tube with or without clot activator. A serum tube with or without gel separator. What is the most commonly used serum tube? Guys, what is the most commonly used serum tube? What is the color of the cup? Red top. Excellent. Those who answered red top. Question. Pag sinabi mo bang red top, is it with or without clot activator? Red top, with or without clot activator? What is our answer? It depends. If it is a glass test tube, but red top, glass test tube, but red top, what is our answer? Without a clot activator. If it is a plastic test tube and red top, plastic test tube and red top with clot activator. Ma'am, bakit pag glass test tube with red top, walang clot activator? Bakit pag plastic with clot activator? Because glass, the glass, guys, in creating your glass test tube, red top, that glass is alumina silica glass. And alumina silica glass, do not forget, is a natural clot activator. So you don't need to add a synthetic clot activator. Whereas the plastic test tube is definitely without a clot activator. Yung plastic test tube na yun, wala talagang clot activator because plastic is never a clot activator. Do not forget. So if it is a plastic test tube, red top, you have to add a clot activator. Or how about gel separator? Ma'am, pag red top ba with gel separator, whether it is glass or it is plastic, without a gel separator, without both the plastic and the glass, red top. How about other serum tubes? Can you give me other examples of serum tubes aside from with red top? Ano ba other examples ng serum tubes? The color of the cup aside from red. Aside from red, what are the other colors of the cup? Oh, is it yellow or is it gold top? When you say serum tube, is it yellow or is it gold top? Tinatanong kita mag-isa ha, kasi magte-take ka ng board exam. So ikaw ang tinatanong ko. Excellent, those who answered gold top. If mom, kasi para siyang yellow, I will agree. It looks yellow color, but it's not actually yellow. It is gold top. Gold yan, guys. Pag tinabi mo ang yellow cup sa gold cup, makikita mo, ay, magkaiba nga sila. So the serum tube is the gold top or the gold cup. Do not forget that. That is the serum tube. Oops. Is it with or without clot activator? It depends. Why? Because pag sinabi po natin gold top, glass test tube, without clot activator, guys. Take note of that. Pero pag sinabi mo plastic test tube, gold cup, with clot activator. Huwag kalimutan. What else? And how about gel separator? Ay, matagal mo nang alam. Whether it is a gold cup, glass tube, gold cup, plastic tube with gel separator. Oops. Take note, those who have text, those who have your review books, meron akong copy dito sa tabi ko, 2020 edition. Tandaan nyo guys, yung 2019, 2020 yan. Di ba nakwento ko na, bakit pa mang cover ganun? Kasi hindi naubos. Thousands kasi ang guys pag in-order. Nag-pandemic, o di ba? Nag-shutdown ang mga review centers. So therefore, let me just remind you people, o di ba, hindi ko mahanap ko anong page. Anong ang page, children? Yung may summary ng collection tubes. There is one page. Anong ang page? Yung pati ako hindi ko na alam. Page 54. So take note, page 54. Those who have handbooks, page 54. You have there the summary of the blood collection tubes. Oops, hindi lang po red top, hindi lang po gold top ang may gel, ang merong ang serum tubes. There are other serum tubes. Take note, there is an orange top. Orange top, according to me, ako ang sarili ko sinasabi ko, according to me, is an emergency test tube. It is a test tube for emergency cases. And bakit ko sinabing test tube for emergency cases? Because the orange top contains the most powerful clot activator. And what is the most powerful clot activator? Thrombin. Ma'am, bakit po sinabing powerful clot activator? Children, if you use a gold top or a red top or any other serum tubes, not except for the orange top, mapapansin mo that the clotting time in serum tubes minimum average of 30 minutes. Clotting time, average of 30 minutes. May lumalagpas pa doon. If you use the orange top with thrombin, well, the clotting is only 5 minutes compared to the 30 minutes. Ma'am, ibig mo sabihin, pag gumamit ako ng serum tube with thrombin, the clotting will be accelerated. Correct. Take note of that. That is the reason why. Anong tawag natin kay orange top? Rapid serum tube. RST. Write it please. Anong tawag natin guys sa orange top with thrombin? With thrombin. RST. Anong RST? Rapid serum tube. What is the color of the cup? Orange. What is the clot activator in the rapid serum tube? That is thrombin. Why rapid? Because the clotting will only be 5 minutes compared to the average clotting time of 30 minutes. Next question. Mom, hindi ba meron tayong SST? What is SST? Serum separator tube. Please write it. Serum separator tube. That is SST. Question. Ma'am, bakit what is the color of the cup if it is SST? Ay, syempre, pag SST, guys, ano ang color ng cup natin? Gold cup. That is the gold cup. That is SST. Oops, tingnan mo yung book mo. Tinignan ko siya kasi baka wala dito. Children, meron ka pa nakalagay dito. Red and gray cup. What is red and gray cup? Combination of red and gray color. Pag tinanong ka sa board exam, how will you describe a cup, a test tube top with red and gray color? Kung tawagin natin yan minsan, children, tiger top. Red and gray color, tiger top, kasi combination, no? 'Di ba ang tiger kasi yellow and black, 'di ba? Ito naman red and gray, minsan they call it the tiger top. Children, it is SST. Ano yung SST? Serum separator tube. Bakit mo siya tinawag na serum separator tube? Because it is with gel separator. So there is red, there is gold, there is orange top, there is red and gray. Pansinin mo guys yan. Oops, meron ka pa itatanong sa akin. Mom, nakita ko dito sa book, merong yellow and gray top. Naku, tignan mo guys yung summary na yan. Merong yellow and gray top combination. Yung color daw ng test tube cup or test tube top, yellow and gray. Oh, that is also with thrombin. So tatanungin mo na naman ako, Ma'am, ibig sabihin po sa board exam, pag tinanong sa amin, simply, which of the following choices is RST, rapid serum tube? Anong unang nasa isip mo? Orange. Ma'am, wala po sa choices na orange top. Ay, huwag ka mag-aalala, meron pang isa. Anong isa? Yellow and gray top. Huwag mong kakalimutan yan. Meron kang yellow and gray top. Nalalaglag ako sa upuan. Yellow and gray top. Take note, children. That is so important. Okay. So, ano tawag natin sa yellow and gray and top and orange? That is, according to me and other sources, stat test tube. Ma'am, RST na, stat test tube pa. Children, board exam is analysis. Not all the time you will see in the question, rapid serum tube. That is very academic. So what is the other term for rapid serum tube? Analyze natin yan. Then it is stat tube. Then it is the best tube for emergency cases. Take note of that. Di ba kapag antay na yung pasyente, guys, emergency na, mag-antay ka pa ng clotting, 30 minutes ang ating average. So what is the best? The NA test tube with thrombin. Do not forget that. NA test tube with thrombin. Not only orange, but the yellow and gray. We call them RSTs, or the stat tubes, or the tubes for emergency cases. Question, Ma'am, what is the serum test tube with gel separator? SST yon. Serum separator tube. Ano ang most commonly used? Gold top. Ano ang pangalawa? Well, yung sinabi ko sa kanina, red and gray. Ayan guys, nasa book mo yan. Huwag mong kakalimutan. The fourth order is the green top, with or without gel separator. Ma'am, bakit nakalagay dyan, naka-emphasize? Hindi natin pwedeng palitan yan. With or without gel separator. The green top means it is with heparin. Oops! Dalawa na po ang divisions niyan. Meron kang green top without a gel separator. There is a green top without a gel separator. And there is a green top with gel separator. There's a green top without gel separator. And there is a green top with gel separator. Mom, how do I know if it is with gel separator and without gel separator? Children, tandaan mo. Green top without gel separator, dark green color. Green top with gel separator, light green color. Again, green top without gel separator, dark green color. Green top with gel separator, light green color. Children, how do you call test tubes with gel separators and anticoagulants? How do you call test tubes with gel separators and anticoagulants at the same time? Just like the light green cup, that is a test tube with gel separator and anticoagulant, because the anticoagulant in dark green top and light green top is heparin. Do not forget that. So how do you call them? Naku, napaka-importante niyang people. Green marble. Anong tawag na? How do you describe a test tube? How do you describe a test tube with gel separator and with anticoagulant at the same time? PST. Write it please. What is PST? Plasma separator tube. That is a plasma separator tube. Aaron J. Garcia. Excellent. Okay, Aaron J. Garcia, excellent. PST, plasma separator tube. Oh, where will you insert the plasma separator tube with heparin? Fourth order of draw. Next is the lavender top. Lavender is of course with EDTA. Hindi naman na natin dapat mapagtalunan ng matagal yan. It is with EDTA. Ma, bakit dyan may nakalagay pa na pink? Ma, bakit dyan may nakalagay pa na pearl top? Ladies and gentlemen, in the latest edition of the Henry's book, Clinical Laboratory Management, Clinical Laboratory Diagnosis by Laboratory Methods, 2022 copyright, 24th edition. Alam ko nang tatanungin mo, children, kung ngayon ka lang umati ng lecture, ano ba ito si Dr. Rodriguez? Paulit-ulit naman si Ma. Bakit lagi sinasabi si Bernard Henry book? Because that is one of the reference books for our board exam, especially in clinical chemistry. Take note. Anong mapapansin mo sa clinical chem books? Yung mga may 24th edition ngayon ha, kung bumili ka ha, congratulations sa iyo. Ma'am, gusto ko po mag-top notcher, ay kailangan mo basahin yung book na yan. Ma'am, hindi ko na kayang basahin, o makinig ka sa lecture ni Madam. Children, buksan mo yung page 28. Anong nakita mo? Ay, ma'am, bakit yung order of draw dito sa 2022 copyright? Lavender lang. Eh bakit sa iba merong pink at saka merong pearl top? Well, because if you are going to check the CLSI guidelines, guys, matagal na po, no? Yours truly will always use the CLSI guidelines in all my lectures. Always use the Ruth McCall phlebotomy book in all my lectures, guys, because those are standard references, okay? Including the John Bernard Henry book. Sa John Bernard Henry book, which is authored now by McPherson and Pincus 2022 edition, children, walang nakalagay na pink and pearl on the 5th order of draw together with lavender. Wala po. Ang nakalagay lang pa rin, lavender top EDTA. I said in the reference book. However, if you are going to check one of the reference guidelines, the CLSI, ano ang sinabi ni CLSI? Oh, in the 5th order of draw, lavender, pink, and pearl. Ma'am, nai-stress na ako. Huwag ka na mai-stress kasi kina-clarify ko na, children. Okay? Ma'am, paano po sa board exam? Relax. Tinanong ka sa board. Ako board of examiner if ever, I will put myself into the shoes of the board of examiners. Hindi ko sa'yo tatanungin ang lavender top. That is mute and academic, so elementary. Take note of that. So, anong itatanong ko? Where will you insert the pink top in the order of draw? What is the answer? The 5th order of draw. Take note. Oh, sinanong ko sa board exam. Well, where will you insert the pearl top in the order of draw? Of course, in the 5th order of draw. Nagkakaintindihan ba tayo mga kapatid sa paniniwala? Okay? Next question. Ma'am, bakit si lavender, si pink, at saka si pearl top magkakasama sa 5th draw? Because they all contain EDTA. Pag nakalimutan mo yan, babangungutin tayo sa board exam. Promise. Uulitin ko ulit sa iyo, children, ha? Wag, ma'am, ano pong isasagot sa board exam? Ay, sinabi ko na, hindi ka dapat malito doon. Ma'am, you mean in our licensure exam, pwedeng ansundin sa licensure exam yung CLSI guidelines. Of course, that's one of the standard and international, one of the standard guidelines, guys. Subok na ni Madam yan. Talagang pagdating sa board exam, it's there, okay? So, it's in the 5th order bucket because they all contain EDTA. Ang tanong, what is the purpose of the pink top? Ladies and gentlemen, ha? I am sure diniscuss sa'yo yan ng 3rd year. Hindi pwedeng hindi. Kaya if you would say, Ma'am, ngayong kulong narinig yan. Una, matindi ang pinagdaanan mo talaga ng pandemic. Pangalawa, baka absent ka ng discussion. Kaya wag kang magme-message sa professor mo, Sir, hindi mo diniscuss siya. Ma'am, hindi mo diniscuss siya. Diniscuss yan, children. Imposibleng hindi. Excellent, Justin Ann Amar. What is the purpose of the pink top? Ray Mark Magleo, excellent. Blood bank. That is for blood bank procedures. Such as what? ABO, RH blood typing. Second, the compatibility testing. Children, what is the other name for compatibility test? Alam mo, sa totoo lang, maraming ano ba yun? Compatibility test. Diyos mo yung kawawa naman yung teacher mo sa blood bank. Ilang beses sa'yo pinaliwanag ng mga kapatid. Anong other name ng compatibility test? Other name of compatibility test? But HLA? Basic. The basic. Excellent. Rubia, Remy, Jane V. Rubia. Cross-matching. Simply, cross-matching. Mom, ibig sabihin sa board exam, ganun, they will use other terms. Naman, hindi po parati yung routine terminology. So in short, what is the purpose of the pink top? ABORH blood typing. What is the second? Cross-matching. How do we call that? Compatibility test. Eto guys ha, According to the book, eto according to books to ha, sasabihin ko sa ito ha, the pink top is also recommended for antibody panel test. Baka sakaling tanungin ka sa board exam, what is the recommended test tube for antibody panel test? Theoretically, it says pink top. However, may however ako ha, most laboratories use serum tube. Ma'am, anong sasagot namin sa board exam? Siyempre, sasabihin ko, sana wag itanong. Okay? Ma'am, paano pag itanong sa board exam? Well, napakahirap sagutin ang tanong na yan, ano? Pero I will go for the red top. Kung ako ha, kasi yun talaga ang usually talagang used is the red top. But if ever they will ask for a special test tube for antibody panel testing, special test tube, then we can answer the pink top. But for routine testing, we use the serum tube. Okay? What is the purpose of the pearl top? Guys, ito walang mag-Google search ha. Tandaan natin board exam ito ha. Kaya nga sabi ko, children, kung ikaw, kung nasa third year ka noon, nasa fourth year ka nitong pandemic, you're always searching the Google, then we will have a problem. Because in the board exam, you will answer it alone. Take note. What is the purpose of the pearl top? Excellent tonic cruise for molecular testing. That is for molecular test. Those who have handbooks, nandun na yan. That is for, nasa book mo yan, page 54, for molecular test. Children, in short, my goodness gracious, great balls of fire, hindi ka dapat magulat sa board exam if you will be asked what is the recommended and the best test tube for nucleic acid test. What is the answer? Pearl top. Next question. What is the best anticoagulant for? Anticoagulant na tanong ha, basahin mo maigi yung question. The best anticoagulant for molecular test if the sample taken is a blood sample. EDTA. Next question. What is that anticoagulant that should be totally avoided? Because that anticoagulant inhibits the DNA polymerase. Remember that we are using DNA polymerase reagent in amplification or PCR testing. Ang tanong, walang mag-Google search. Kailangan i-gauge mo yung sarili mo ngayon, children. Because you'll be taking the board exam this August. So, sabi ko nga sa'yo, di ba, huwag mong sayangin ang pag-upo sa review center, children, nang hindi mo sinasagot yung mga questions. Ay, sayang, sagutin mo. Mom, mali po ako. Hindi ba yung brain cells natin always remember the mistakes? Hindi niya naaalala yung greatness natin. Ang naalala niya, yung pagkakamali natin. Tinatanong kita ngayon, kung ngayon ang board exam, what is that anticoagulant that should never be used in nucleic acid testing? Because it inhibits the DNA polymerase reagent. Excellent trademark, Magleo, heparin. That is heparinized tube. The green top never used that anticoagulant because it inhibits the DNA polymerase reagent. At the same time, the heparin may be co-extracted with the DNA. May be co-extracted with the DNA. Ine-extract mo yung DNA, gumamit ka ng green top, ine-extract mo yung DNA, gumamit ka ng green top, pati heparin na-extract kasama ng DNA, children. That's the reason why that heparin now will inhibit, co-extracted with the DNA, will inhibit the DNA polymerase reagent. Are you learning, children? Are you learning? Did you learn something new? Parang hindi naman ata kayo masaya sa lecture ko eh. Happy pa kayo, guys? Did you learn something new? Tandaan mo yung mga kapatid sa paniniwala. Next question. Eto sigurado ituturo to ni Dr. Joshua Mandanas ha. Kung tatapos na kayo sa kanya, alam ko tinuro to sa ni Dr. Joshua at makinggan mo maigi yung lecture niya. Ma'am, di ba wala naman po molecular biology and diagnostics sa subject sa board exam? Wala. Ang tanong, ma'am, saan po itatanong ito ko sa molecular biology and diagnostics na tinake namin nung nasa third year po kami? The questions will be in virology, bacteriology, clinical chemistry, immunology. Diyan po itatanong ang MPD. And laboratory management. Do not ever forget that. Tanong, children. Alam naman ng buong Pilipinas na yours truly is of course teaching bacteriology. Sa totoo lang, ang first lab ko, clinical bacteriology. Pangalawa lang ang clinical chemistry. Kaya pala si Madam may libro ng clinical bacteria. Correct! Because my first lab is clinical bacteriology, okay? Guys, eto tatanungin kita ngayon ha, kung board exam ngayon ha, what is the source of the DNA polymerase reagent which is used in PCR? Hindi ka pwedeng mag-amplification without DNA polymerase reagent. That is a reagent. Tanong, what is the source of the DNA polymerase reagent which is used in PCR techniques? 5 seconds. My goodness gracious. Pag hindi ko po nasagot yan, hindi ako pwede mag-take ng board exam. Yes, kasi that is a fundamental question. Pag sinabing fundamental, isang semester ka nag-MBD. Dapat yan ay masagot mo. Sa totoo lang. Because that is always being mentioned in the lecture. What is the source of the DNA polymerase reagent? Naku, walang nakasagot. Si Ryan Moraleta. Really? Guys, yung klase ko last March at saka last January came from the old curriculum. Wala silang MBD ha. Wala silang molecular biology and diagnostics. But to tell you children, they were able to answer that same question. Wala kang MBD yun. Kayo may MBD kayo. Kaya mas marami ang tanong ng molecular sa inyo children. My goodness gracious, hindi katakataka itanong sa iyo yan. What is the source of the DNA polymerase reagent? Excellent, Tricia Angeles. Kailangan pareho kayo ng answer ni Tricia Angeles ha. What is the answer of Tricia Angeles? Thermus aquaticus. Bigla ka na tulala. Lord, tinatawag mo na naman si Lord. Okay, Lord. Lord, bakit alam ni Tricia? Bakit ako hindi ko alam, Lord? Thermus aquaticus is a bacterium. Isn't it, children? That is an example of a thermophilic bacterium. Ma'am, ibig mo po sabihin, the source of the DNA polymerase reagent is a heat-stable bacterium. Matagal na po. Okay? Heat-stable bacterium. That is the first requirement. The DNA polymerase reagent should be a heat-stable reagent. Ma'am, bakit po? Because the PCR techniques involves high temperature processing. Hindi ba may 92 degrees ka dyan? Ay, oo nga pala, ma'am. That is the reason why you use a temperature stable, a heat stable reagent. And what is the source of the heat stable reagent? Should be a heat stable source. And what is that? The Thermus aquaticus. Mom, are you saying that the DNA polymerase of the Thermus aquaticus bacterium, the DNA polymerase of the Thermus aquaticus bacterium is the DNA polymerase reagent that is used in the PCR techniques? Matagal na po. Did you learn something new? Parang palungkot yung nile-lecturean ko. Ma'am, bakit nakalimutan ko yan? Kaya pinapaalala ko siya sa you children. Oops! Do not ever use heparinized sample because heparin inhibits the DNA polymerase. Take note. Huwag mong kalilimutan yan. And DNA polymerase reagent is a heat-stable reagent because the source is a heat-stable organism. And the best anticoagulant should be what? EDTA. Take note. It preserves well the nucleic acid. True or false? Pink, the pearl top is with gel separator. The pearl top is with gel separator. Walang titingin sa book. Walang mag-Google search. Sinabi ko sa iyo, you don't use the Google search in the review because magiging dependent ka dyan. Dyan ka mai-stress pagdating sa board exam. Remember guys, uulitin ko, if kung nasanay ka sa Google search nitong third year, fourth year, sa online, learn to detach yourself starting last time. Okay? Matagal ko na sa yung sinabi yan. Kasi yan ang makakapagpa-stress sa'yo, children. Kasi pagdating mo sa board at hindi mo kayang sagutin, iisipin mo, sayang, sana may Google search. Kaya ngayon mo ma-appreciate ang iyong school, who was so strict when you were in college that they really watch you with camera during exam. Pinapanood niya yung monitor mo, nakatutok yung isang camera sa monitor ng laptop mo. Tinitignan ko, nag-Google search ka. Ano ang ginawa ng most students? Nag-complain, sumulat sa CHED, "Dear CHED, our school is so strict." Now, this is the board exam. Kaya ka tinrain ng ganun ang school mo para pagdating mo sa board exam, hindi ka po ma-frustrate. Kasi wala ka noon pagdating sa exam. This is an on-site examination. True or false? Pearl top is with gel separator. What is the answer? True. It is with gel separator. Mom, you mean the pearl top is a PST? Correct. It is a plasma separator tube. Tingnan ko nga ang page 54. Oh, wala pala siya dito. Okay. Oh, it's here. It's here, guys. Nakalagay yung EDTA with gel. Kala ko wala. Ma, bakit po nakalagay sa book white top? Oh, ito, children, ha? Tandaan natin, children. The former description of pearl top is white top. Kaya ang nakalagay sa 2020 edition, white. Ngayon, ginawa na nilang pearl. Take note. Remember that. Alam mo, binabagalan ko, dapat nasa carbohydrates na tayo kasi mai-stress ka dyan pag binilisan ko itong discussion na to. So in other words, in the fifth order of draw, what is the concern? It is all EDTA with variations. There is a lavender top, there is a pink top, and there is a pearl top. Lavender top without gel separator. Pink top without gel separator. Pearl top with gel separator. Do not forget that. True or false? We are using lavender top in clinical chemistry. We are using lavender top in clinical chemistry test. True or false? True. Tandaan natin, guys, sa true, ha? Ops, ang daming sumagot ng true. Tinatanong kita, Mom, ang sagot ko false. Huwag ka matatakot. Malalaman mo yung answer bakit may lavender top sa clinical chemistry as we go along with our lecture. Do not forget that. May sumagot na. Sabi ni Valerie, at sabi ni Valerie Amor Esteliore, ni Kristen Kylie Brinas, ni CTI na tumanding, at sika ni Ray, ni Joanette Razo. Ma'am, sasabihin ko na lang kung anong purpose. Kung sawa na ako dyan sa question na yan. Correct. Sinabi na nila kung anong purpose. Excellent. And also Rubia, Remy Jane, excellent. They mentioned the purpose of the lavender top in clinical chemistry. Huwag mong kakalimutan na sinabi ko sa iyo, children. Gray top is the fifth order of draw in the standard order of draw. Look at my eyes. There are only 6 draws in the standard order of draw. The gray top, there are 2 combinations of gray top. 2 preparations of gray top. What is the first preparation? The sodium fluoride and potassium oxalate in 1 gray top. What is the second combination? The iodoacetate and heparin in 1 gray top. Ladies and gentlemen, you don't put all these 4 additives in 1 gray top. Ang sinabi ko, ha, separate, children. With my very emphasis, very glaring eyes, ha, separate tubes. So therefore, there are 2 types of gray top. There are 2 types. The sodium fluoride and potassium oxalate, the iodoacetate and heparin. Mom, what is the purpose of the gray top? It is also known as the anti-glycolytic tube. It is also known as the anti-glycolytic tube. Take note. Huwag kalimutan, the anti-glycolytic tube. Take note of that. Oops. Well, sodium fluoride and iodoacetate are both anti-glycolytic agents. Okay, the sodium fluoride and iodoacetate are both anti-glycolytic agents. And the potassium oxalate and heparin are anticoagulants, definitely. And what is the most commonly used combinations? The first, the sodium fluoride and potassium oxalate. Take note of that. That is the most commonly used anti-glycolytic combinations. But later on, meron akong i-discuss pa dyan ha. Basta sa ngayon lang ha, introduction pa lang. The gray top is also known as the anti-glycolytic tube. That is the reason why it is preferred for glucose testing. Huwag mong kakalimutan yan, people. And that is the orange top. That is the gold top. That is the gray top. Take note, this is not yellow. It looks yellow, but that is actually the gold top. An example of serum separator tube. What else? And please take note that EDTA then EDTA, take note, increases plasma, pasensya na guys sa mga commercial people. I asked for my tea. Okay? And EDTA increases plasma potassium by 25 milliequivalent per liter because EDTA contains potassium. We don't use that for electrolyte test. What else, guys? And plastic tubes. Alam ko, tatanungin mo yan. Mom, para meron po ako nakikita EDTA na powdered. Hindi powdered yun, spray dried. Mom, bakit para may nakita po ako EDTA na liquid? There are two types of EDTA tubes. The plastic tube, purple top, and the glass tube, purple top. Doon muna tayo sa purple kasi yan ang common sa'yo. If it is a plastic tube, purple top, it contains dipotassium EDTA. That is the spray dried EDTA. Next, pag sinabi mong glass tubes, EDTA, tripotassium EDTA yan. And that is the liquid form EDTA. Mom, what is the most commonly used, the plastic tube or the glass tube EDTA? Plastic tube because of biohazard consideration. That's why the dipotassium EDTA spray dried is the most commonly used. Siyempre tatanungin mo din, Mom, si pink top, Mom, si pearl top, di or tri, dipotassium EDTA. Bakit? Plastic tubes po ang pink top at saka pearl top. Children, wala na po tayong ginagamit na glass test tubes. All the collection test tubes, all the collection test tubes, meaning for sample collection, they are all plastic. No, because of biohazard considerations. Kasi kung glass, baka mamaya ma-broke siya sa kamay mo, ay magkakasugat tayo. Paano kung may hepatitis virus yun? Paano kung merong other viruses na pwedeng, that can cause transmissible diseases or infection through blood? Then we have to use plastic tubes. Huwag kakalimutan, children, only blood culture tubes, glass non-additive serum tubes, or plastic serum tubes without a clot activator may be collected before the blue top. Take note, before the light blue top. Guys, naka-emphasize sa akin, light blue. Mom, napansin ko nga, bakit sa mga books nakalagay blue top? This is review for the board exam. Light blue top. Kasi may blue at saka merong light blue. May royal blue at saka may light blue. That's why we have to emphasize it. I'm a very specific professor. I don't just say blue top in the order of draw. Second order is blue top, incorrect. Light blue top. Why? Huwag mo kakalimutan yung sinabi na yan. Yes, pwede ka gumamit ng plastic serum tubes. Provided yung plastic serum tubes without a clot activator. Huwag kalimutan. Siyempre, pag may clot activator yan, that will affect the coagulation test. Huwag mong kalimutan yan, children. But remember, general rule, the plastic serum tubes, general rule, with clot activator. Well, if you can find a plastic serum tube without a clot activator, then you can use it before the light blue top. Take note of that. Next, how will you label the test tube? Kasi nga, nanggaling kayo sa blended learning, ang third year nyo, purely virtual, internship, blended, because there is a limited face-to-face. Take note. Huwag kakalimutan yan. Guys, meron lang ako i-message. Okay. Take note. What else, guys? Sasagutin. Dami kong commercial. Sasagutin ko lang. Then, what else? How will you label the test tubes? Baka tanungin ka sa clinical chemistry or hematology or lab management. Of course, you have to put the complete name of the patient. Clark Bernard C. Yung iba, pati yung complete middle initial. According to institution's protocol, pati complete middle initial they have to write. But the middle, I mean complete middle name you have to write. But CLSI said acceptable na rin ang initial lang. But if the institution said complete middle name, then you have to write it. Then you have also to include the patient ID number. And what else? The date of collection, the time of collection, the phlebotomist initial. And how about barcode? Baka tinanong ka sa board exam. Aside from writing, instead of writing the complete name of the patient, the patient identification number, take note, the date and the time of collection, what is the alternate? We can use barcodes. Ma'am, yung barcode, kasama na yung time and date of collection, check. Kasama na sa barcode. Ibig sabihin, may dala si phlebotomist na barcode printer. It is handy. Take note. Date, time, and initials of the phlebotomist must be on the label of each test tube. Next, automated systems may include handy lang po ang barcode printer. Okay? What else? And please take note of this, guys. Take a photo. Either this question will be asked in hematology or in clinical chemistry. Tandaan natin, children. There is, pasinin mo ang top, isa-isa ha, light blue top. So anong nasa mindset mo? Wow, coagulation test. Check. Ano pang tatandaan natin, children? Ma'am, bakit may maximum fill? May line talaga yan. May line yan. Maximum fill. Oops, there is also a bar line for minimum fill. Basahin mo maigi ang board exam. If that is a plain light blue top, if that is a plain light blue top, you are required to draw at least 2.7 ml of blood. At least 2.7. That is the minimum fill. Do not forget that. However, if you are using a light blue top with Hemogard ang tawag dyan, guys. Light blue top with Hemogard. It's like a transparent cup over the light blue cup. Over the light blue cup, there is a transparent cup. Oh, what is the minimum fill? 1.8 ml of blood. That is the minimum fill. 1.8 ml of blood. Huwag kakalimutan. Take a photo, people. Okay, minimum fill lang yan, and that is the maximum fill. Very important siya. Ma'am, why do we have to remember the minimum fill? Because it depends on anticoagulant to blood ratio. Tandaan, guys. Notes to remember, page 42. TDM means therapeutic drug monitoring. Therapeutic drug monitoring samples should not be collected in SST. What is SST? Serum separator tube. Guys, do not be confused. What is the commonly used? I said commonly used specimen for therapeutic drug monitoring. Serum. I didn't say the only sample. I said the commonly used, the routine sample for monitoring therapeutic drug. Oh, sorry. For monitoring therapeutic drug, that is serum. Bakit nakalagay dyan? We should not use serum separator tube. Yung separator tube, huwag po gagamitin yung serum separator tube. Why? Because the gels absorb the drugs and that may lead to false decrease. Take note, ha? O, nire-remind kita, gold top yan. What is the most commonly used serum separator tube? Gold top. This gel absorbs some drugs that may lead to false decrease. Serum is the routine sample, but we use either the red top or the orange top or any other serum tubes without gel separator. What else? And also, i-remind lang kita, ha? Ma'am, ano purpose ng sodium fluoride anti-glycolytic agent. What is the purpose of the potassium oxalate in gray top? Anticoagulant. What is the purpose of iodoacetate? Anti-glycolytic agent. What is the purpose of the sodium heparin together with iodoacetate? The sodium heparin is the anticoagulant. So what is the purpose of sodium fluoride? Sinabi ko na say kanina, anti-glycolytic agent. That is best for measurement of glucose. Take note about, guys, mamaya may ipaliwanag pa ako sa iyo dyan about the sodium fluoride story. Basta sa ngayon, utay-utay lang. Dahan-dahan lang. That is the purpose. Generally speaking, other use. My goodness gracious. Lactate is a product of glycolysis. Of course. It is a product of glycolysis. Therefore, we should use an anti-glycolytic tube because we have to prevent in vitro hemolysis. Tandaan mo guys, we have to prevent in vitro hemolysis if we are measuring lactate. So fluoride and oxalate block glycolysis. Naku, matagal ko na itong tinuturo guys. Noong unang panahon, what is the routine sample for measurement of ethanol? Serum. What is next to serum? Then, EDTA plasma. Then, now, what is the recommendation? O, plasma pa rin. Plasma pa rin. Noon kasi serum ang first. Pangalawa, EDTA plasma. Ngayon, hindi na serum. Ano na? Plasma. But not EDTA plasma. It should be what? Fluoride plasma. Pag sabi fluoride plasma, fluoride is the anti-glycolytic agent, not anticoagulant. It is the sodium, or rather, it is the potassium oxalate, which is the anticoagulant. So, mom, you mean gray top? Gray top is the best test tube for ethanol test? Check. The gray top is the best test tube for lactate test? Check. Fluoride, oh, ito na nakalagay. Ito na sinasabi ko, meron akong i-explain sa iyo. According to the latest edition of John Bernard Henry, and thank you, Dr. Macpherson and Ping and Dr. Pincus, because finally, nandun na siya sa reference book. Kasi noon, ang hirap ikwento to pag wala kang reference book, okay? Guys, fluoride has little effect on reducing glycolysis. When I took my ASCPI exam, children, that was one of the questions. Fluoride has little effect on reducing glycolysis when within the first 4 hours of storage. Huwag mo kalilimutan yung statement na yan. Fluoride has little effect on reducing glycolysis within the first 4 hours of storage and may not reach complete inhibition until 4 hours of storage. In other words, are you saying Macpherson and Pincus 2022 that gray top is no longer the recommended anti-glycolytic tube? Ano sabi ni Macpherson? I recommended pa rin. However, we have to understand that it would take more than 4 hours to really achieve complete anti-glycolysis. So if you will use the gray top within an hour, huwag ka magugulat ha. Hindi mo sineperate yung red cell sa plasma. Ay huwag ka magugulat, medyo affected pa yung glucose kasi hindi pa na-prevent yung glycolysis because complete anti-glycolysis will take place. Take note, more than 4 hours. So ang tanong, so meron na pong other anti-glycolytic tube. Mamaya natin malalaman. Clot activators example, thrombin is placed in orange top or in yellow and gray or in other test tubes. But what is the most common RST? That is the orange top. Silica and diatomite or selite are other examples of clot activators. Ano po pangalan ng gel na yan? Na nasa gold top, which is also present in plasma separator tube. That is the thixotropic gel. Present in PST and SST, thixotropic gel. Take note of that. That is the thixotropic gel. What else? And IV fluid contamination, page 44. Guys, what is our rule? Do not draw blood from that arm with IV line. So, itong left arm, may IV line. Ay, hindi ko dyan pwede mag-draw ng sample. Dito sa right. Eh, paano kung pareho may IV lines? Eh, diabetic si patient, diabetes mellitus, hindi pwede mag-sample collection sa ankle vein. Naku, may golden rule, nakalagay dito. Well, you can draw blood from that arm with an IV line. You can draw blood sample provided it should be below the IV line. Ma'am, yung IV line po nandito sa dorsal vein. It should be below. Yes. Ma'am, nandito yung IV line. Pwede po dito sa dorsal vein. Yes. Ma'am, nasa dorsal vein din yung IV line. It should be below the IV line. Below that. Mahirap yun. Kaya pag naglalagay ng IV line, medyo itinataas nila. So that the area below that is for sample collection. And what is the golden rule? If you draw blood from an arm with IV line, it should be below the IV line and you should discard the first few milliliters of blood. How few is the few milliliters? Well, 2 to 5 ml of blood, whole blood should be discarded. Take note, 2 to 5 ml of blood should be discarded. Why? Because that is filled with IV fluid. Then after discarding the first 2 to 5 ml of blood, the next sample, that is now for chemistry tests. Take note. Ma'am, paano kung hindi nag-draw below the IV line? Nako, X. Ma'am, paano pag hindi nag-discard ng first few milliliters of blood? X. Ma'am, what if the IV line was not temporarily stopped? Remember, before you draw blood from an IV line, you should inform the nurse or attending caregiver, Mom, we have to stop the IV line for a while. Take note, for a while. Ikaw ba mag-i-stop sa medical technologies? You will temporarily stop the flow of the IV line. It should be the attending caregiver or the nurse. Sila po ang gagawa nun. Then, draw the first 2 to 5 ml of blood. Then, you have the succeeding blood sample. The IV line was not stopped. If you did not draw the first 2 to 5 ml, the blood collection was not below the IV line. May IV fluid contamination. Remember that ang IV fluids po natin, pag makikita mo yung IV fluid bag, ano nakalagay na label? Glucose, dextrose, or pwedeng electrolytes, chloride, potassium, and sodium. What happened? Increase of infused substances because the IV line was not stopped, because the blood was drawn not below the IV line, because 2 to 5 ml of blood, first 2 to 5 ml of blood was not discarded. What happened? It leads to decrease in urea and creatinine. Nag-draw ka ng sample sa arm with IV line. Ang IV line pala, dextrose or glucose. You did not stop the IV line. Blood was not drawn below the IV line, and no blood was discarded, at least 2 ml, wala pa rin. Anong nangyari, guys? Ito, syempre, yung sample na na-collect mo, daming IV fluid doon, isn't it? So what happened, guys? That will lead to false increase of glucose. 10% contamination with 5% dextrose will increase blood glucose by 500 milligram per deciliter. Take note of that. You have to stop the IV line at least 2 minutes. Kasi yun yung sample collection mo. At least 2 minutes. Okay? What else? Oops, tinanong ko sa board exam. 10% contamination with 5%. Yan ang percentage ng dextrose mo sa IV fluid, no? 5% nasa IV bag. 5% yan ang dextrose. 10% contamination with this 5% dextrose, that is 500 milligram per deciliter increase in blood glucose. Paano ko tanongin sa board exam? 20% contamination. Naku, yung blood glucose mo, 1,000 milligrams na. Kasi yung 10%, 500. Yung 20%, approximately, plus 1,000 milligram per deciliter of blood glucose. If only 10%, plus milligram per deciliter. Page 44, what are the other blood collection units? Nakalagay na dyan sa book. Yan po ang pink top. Tingnan mo guys, without gel separator. Take note, that is for blood bank procedures. That is your brown top. Sometimes they call it tan top. Naku, wag mo kalilimutan yan si tan. Or the brown top. What is the purpose of the tan or brown top? Lead testing, period. Ngayong araw lang nito nag-uusap tayo ha. The purpose of the brown top or lead top, lead testing. Toxicology is specific. Lead testing. Next, how about the royal blue top? Yun ang sinabi ko sa you guys, that there is a light blue and there is a royal blue. That's why I'm very specific with the order of draw. It is light blue. Kasi kung sinabi mong blue, mag-iisip ka, di ba may royal blue? That's why it is light blue top. The royal blue top, remember, nandiyan na sa book mo, page 54, there are two preparations. There is a royal blue without anticoagulant. Children, how will you describe a royal blue top without anticoagulant? It is defined as a chemically clean test tube. It is a chemically clean test tube. Do not forget that. Ma, bakit mo po ine-emphasize yan? Because the royal blue without anticoagulant described as chemically clean test tube is best for trace element studies. That is best for trace element studies. I said trace element studies. That is best over the royal blue with anticoagulant. The second preparation of royal blue, there are two preparations. Bakit ma'am naging dalawa? Because do not forget that sodium heparin is also placed in royal blue top. EDTA is also placed in royal blue top. Ma'am, ibig mo sabihin, there are three preparations of royal blue top without anticoagulant, with sodium heparin, and with EDTA. Next, what is the use of the royal blue top? Generally speaking, toxicology, therapeutic drug monitoring, micronutrient studies, trace element studies, therapeutic drug monitoring, toxicology, micronutrient studies, and trace element studies. Ano ang best sa trace element? Yung chemically clean without anticoagulant. The rest, either so with anticoagulant, with sodium heparin, or with EDTA. I'm sure tatanungin mo ako, ma'am, sinabi mo po kanina pagka therapeutic drug monitoring, the commonly used sample and the routine sample is the take note serum. Correct. Ma'am, you mean for therapeutic drug monitoring, the commonly used royal blue top used is the royal blue top without anticoagulant? Yes. For therapeutic drug monitoring, since serum is the routine sample, the commonly used top is royal blue without anticoagulant. Huwag kalimutan yan ang ibang examples, guys. This is the yellow. There is a yellow top. Yan ang yellow, guys. Yellow. Hindi yan gold, yan ang yellow. Okay? This is the black top, also with citrate. Nandiyan na, guys, ang explanation sa yung book. Ma'am, bakit ka may yellow top? Children, what is the purpose of the yellow top? And what is the anticoagulant that may be placed in yellow top? What is the anticoagulant that may be placed in yellow top? What is the answer? Well, pwede ka maglagay ng SPS, sodium polyanethyl sulfonate. That is for blood culture. But usually, guys, pag blood culture, hindi po test tube, but bottle. Blood culture bottle is with SPS, the sodium polyanethyl sulfonate, and that is the anticoagulant. All blood culture bottles with SPS, the sodium polyanethyl sulfonate, that is the best anticoagulant used in blood culture bottles. Tandaan natin, guys, the sodium polyanethyl sulfonate. Pag test tube lang na ganyan, ma'am, yellow top, ano ang description? It is with which anticoagulant? Ano pa yung isang anticoagulant na nilalagay sa yellow top? It is actually, yes, Raymark Magleo, excellent. And Aliyah Cabrera, what is that? ACD. What is ACD? Acid citrate dextrose. That is, oh, tingnan nga natin kung nasa page 54, ha? Acid citrate dextrose. Oh, it's there. What is the purpose of the acid citrate dextrose or that yellow top with ACD? That is for HLA typing or phenotyping. Children, the pink top is for blood bank procedures. ABORH typing, cross matching, and that is a special tube for antibody tests. Take note about most routine procedure use serum. Do not forget the children. OPS, but for HLA and phenotyping, HLA typing and phenotyping, we use the yellow top because the best anticoagulant is acid citrate dextrose. Of a discard tube is a partially filled tube. And this normally needed only when the sample is drawn from a wing set or intravenous catheter. Tanong, alam kong tatanungin mo yan. Ma'am, how would I know that that is a discard test tube? What is the purpose of the discard test tube? To draw blood from an arm with IV line. Even if you will draw blood from an arm with IV line, even if you will draw it below the IV line, even if you will stop the IV line, still you have to discard 2 to 5 ml of blood. Even if you will draw blood sample below the IV line and you will stop the IV line, still you have to draw 2 to 5 ml of blood and discard it. Tanong ng bayan, do we have a discard tube? Oh, yes. Next question. What is the color of the top? Napaus ako. Walang mag-Google search. Mom, hindi ko po alam. Congratulations kung hindi mo alam because your brain and our minds will only remember our mistakes, isn't it? That's why mistakes are the greatest professors. What is our answer, children? Yes, Garcia Aaron J. It's not actually a color, but more of a transparency because it is defined as a clear cup. Clear cup. Ma'am, bakit parang may red? Hindi pinapansin yan. It is described as a clear, kasi kaya mo transparent, clear cup. Okay, so tinanong ka sa board exam, which of the following describes a discard test tube? Anong hahanapin mo sa choices? Clear top, naku walang clear top. Transparent top, naku walang transparent top. Colorless top, naku meron. That is the answer. Ma, parang kung merong red top, orange top, white top, and transparent top. What is our answer? This is not white. What is the answer? Transparent. Because when you say white top, that is the former name of pearl top. Take note, that's not white. That is transparent, that is clear, and that is colorless. Huwag kalilimutan, guys. Next, then, ito nakuha ko lang to sa internet, pero in fairness, may future. Hindi po lahat ng nasa internet na information ay tama. Take note of that. Kaya kayo nagkakamali sa exam. Mom, nabasa ko kasi sa internet yon. So it means you open the Google search while taking the examination. Okay? Kaya sabi nila noon ako, paano nalaman yun ni Dean Rodriguez na nag-open ako ng kasi kukuha ka ng wrong answer. Okay? Children, eto this is a very reliable source. Oops, if ever tanungin ka sa board exam, where will you insert the clear top? Ladies and gentlemen, before sample collection for coagulation test, take note before sample collection, guys, for coagulation studies, like blue top, there are institutions, hospitals and medical centers requiring use of discard tube. Take note of why? To remove tissue, that tissue thromboplastin that may interfere with coagulation tests. Let me say that again. There are some institutions requiring the use of the clear to 5 ml of blood before the light blue top. Ang nakalagay daw sa requisition form, coagulation test, prothrombin time, activated para sa thromboplastin time, nakalagay doon sa request. OMS, anong ginagawa ng ibang institutions? Oh, there are 2 tubes that will be used. Ano yung una muna? The clear top. What is the purpose of using clear top before the light blue top? To remove the tissue thromboplastin that may interfere coagulation test. Then, after the 2 to 5 ml discarded blood, then you use now the light blue top. Tandaan mo yan, children. Kaya meron kang baka tanungin sa board exam mo, i-insert, Mom, bakit nakalagay dyan special, walang color? Yan ang sinasabi ko sa iyo kanina, that according to CLSI, there is no specific color of the cup for blood culture bottles because there are different colors of the cup, which I also agree. However, in the 2022 copyright 24th edition of John Bernard Henry, which is one of the reference books, hindi niya sinabing special, nilagay pa rin niya yellow top. Huwag ka matatakot sa board exam. Basahin mo yung question. Which of these tubes should be used for blood culture? Nakalagay, yellow top, ACD. Ay, syempre hindi. Because ACD is not used for blood culture. Nakalagay doon, special tube. Oh, mom, nakita ko red, orange, yellow, ACD, special tube. Doon ka sa special. Because that is the designation of the CLSI. Oh, red and gray, the gold, the green, the lavender, ayan. That is the purpose. One of the reasons why there is lavender top in clinical chemistry. I didn't say the only one. I said one of the major reasons is the HbA1c test. Those who answered HbA1c test a while ago, direct message and public message, excellent. Then the gray top, then there are 2 reasons. The blood alcohol, hindi lang blood alcohol, lactate test. Do not ever forget, lactate is a natural product of glycolysis. Therefore, we have to inhibit in vitro glycolysis to avoid the false increase of lactate. Take a photo, please. Ito, kuhanan mo talaga ng picture. Ito, sinare lang to sa akin ng mga board reviewers. Alam mo po, Dr. Rodriguez, panalo daw, panalo, winner. Yung sinabi mo sa mga students na, do not forget the color code of the needle cup, even the gauge of the needle. That's why it is in your book. Tignan mo sa book mo, 2020 edition, no? Printed 2019 cover, nandiyan ang gauge ng needle. Ay, oo nga. Hindi lang yun ha, sinabi ko pa sa'yo kung ano yung, take note that, I'm sorry, dito pala, sinabi ko pa sa'yo yung length ng needle. Ma'am, pati length ng needle, tinanong sa board exam. Hindi ko alam yung sila lang ang nagsabi sa akin. Because it should really be part of the lecture even in the 3rd year. Okay? OMS, anong common? Eh, syempre green, 21 gauge. O, ayan guys, 21 gauge yan. Pag black, ladies and gentlemen, the black color of the needle cup and the black color of the needle hub, if it is arranged, that is the 22 gauge. Huwag mong kakalimutan yan. That's so important. There's a pink, 18 gauge, and 19 creamish. Or sometimes they call it dirty white. Okay? Take note. Yan ang mga needle hub, counterpart ng needle cup. Yellow is the 20 gauge. What else, guys, then? Capillary puncture. For the capillary, so we have the veni puncture and we have the capillary puncture. Mom, what is the standard needle for sample collection? 21 gauge. Mom, for children and those with difficult veins, 23 gauge. For children and those with difficult veins, 23 gauge. But what is the standard? 21 gauge. Take note of that. That is 21 gauge. And the length is indirectly proportional with the gauge of the needle. The length is indirectly proportional with the gauge of the needle. What else? And how about capillary puncture? Well, after veni is capillary. This is the skin punctured blood. And 1.75 is the length of the lancet. 2.0 to 2.5 millimeters is the incision depth. Less than 2.0, neonates and children. I'm sorry, neonates and infants is less than 2.0 millimeter. Less than 2.5 millimeter, that is for, less than 2.5 millimeter, that is for 1 year old and above, and also for adults. And for newborns and infants, of course, the lateral and the medial heel surface, ito lang pong may shade ng purple, from there up to here, from there up to here. The lateral, yun yung katapat ng toe. The medial, yun yung katapat ng big toe. These are the only sites for newborns and infants. When you say infants, 0 age. Take note, wala pa siyang 1 year old. 0 age. That is the lateral and medial heel surface. Well, according to many guidelines, we can only collect sample from the fingertip of patients, fingertip 1 year old and above. The third and fourth finger, 1 year old and above. Kaya pagka infant, newborn, lateral and medial heel surface. Only one prick, only one attempt. And of course, you have to use, guys, you have to use gloves and sterile lancet. What else? How about the order of filling micro collection tubes? Order of filling micro collection tubes. Meron din pala. Oh yes, the lavender is the first. That is the EDTA. The tubes with other additives, or meaning with other anticoagulants. And the last order is the non-additive tube. Alam ko, mapapansin mo yan. Bakit ang first order sa micro collection tubes? Si lavender. Then the other tubes with additives. And the last is the serum tube. Parang baliktad, ma'am, sa big tubes. Because ang capillary blood, easy to clot. Tandaan natin, mas mabilis mag-clot ang capillary blood. That's the reason why we use first the lavender top. This is heparin, green top. This is serum tube, red top. This is gold top, coated test tube. Ma'am, di ba pag gold top, may gel separator? If you will look closer to your monitor, no, laptop monitor, makikita mo, guys, ito parang merong, ay, oo nga, ma'am, parang may gel, o ito plain, wala ka makikita ganyan. Ay, oo nga, parang may gel separator na square. Yes, that is a gel separator. Ma'am, bakit coated? Because this type of microcollection tube coated is designed for photosensitive analytes, just like bilirubin. Mom, do we have a big test tube which is coated? Meron din. Also designed for what? Photosensitive analytes, just like bilirubin. And then we have the EDTA, the purple top. These are the other examples of your microcollection tubes. Alam ko lang sasabihin mo, Ma'am, bakit eto dark green? Heparin. Ma'am, bakit eto light green? Heparin. But meron akong sinabi sa iyo, pag light green, it is with what? Gel separator. Okay. Tapos yung dark green, ma'am, tama nga ang sinabi mo, wala pong gel separator. Correct. Ma'am, bakit ito light green? Tapos amber na naman, coated. This is light green. Hindi mo lang nakikita sa loob kasi masyado ng dark yung coat. Light green with gel separator inside. Ma'am, bakit naman coated? For photosensitive analytes. This is gold, this is gold, this is with gel separator, also with gel separator coated. Why coated? Also for photosensitive analytes. Meron ganyang big tubes, hindi lang microcollection tubes. Arterialized capillary blood. Ma'am, ano to po to? Arterial blood or capillary blood? It looks so confusing. Sabi mong ganun, ma'am. Ma'am, bakit para po siyang confusing? Take note, confusing. May question dito. Di po ba after EDTA microcell tube, may slide prep pa po? What do you mean by my slide prep? Are you referring to, how do you call it? You're referring to peripheral blood smear? Sorry. You are referring to blood smear? Are you referring to, yes, okay, blood smear. Yeah. Meron pang blood smear. Di po ba after EDTA microcell tube, after EDTA microcell tube, may slide prep pa po? Yes. Kasi ideally guys, dahil nagka-capillary puncture ka na, plus mag-correct ka na rin ng blood smear using the peripheral blood. Is that what you're trying to say, Iha? That since that is skin punctured blood, then why not collect peripheral blood smear? Is that what you're trying to say? Or you will get drop of blood from that microcell test tube and prepare a blood smear? Alin ang ibig mo sabihin dito? The peripheral blood smear from the skin punctured site or blood smear from the microcell tube EDTA? Okay, tama. So tama ang question ni Miss Katrina Carlos. Ma'am, di po ba pagka magkokole ka ng blood, skin punctured blood, and you will transfer it to an EDTA purple top microtube, isn't it, ma'am, the recommendation is still to draw sample from that exact skin punctured site? You have to prepare a peripheral blood smear from that skin punctured site. Yes, yun kasi talaga guys ang recommendation. Better, since nag-skin punctured ka na, doon ka na kumuha ng blood smear mo para directly peripheral blood smear. Kasi there are many studies saying that if you will compare the blood smear prepared from microcollection tube, there is little difference when you compare it with a peripheral blood smear. Kaya ano sabi? Mag-prepare ka pa rin ng direct peripheral blood smear. So you can compare it with the blood smear prepared from the purple top microcell tube. Excellent, Katrina Carlos. Next, ma'am, ano to? Arterial blood or capillary blood? Let us check. Page 48. What is that? Purpose. Guys, I'm a very specific professor, ha? Lalo na po mga special sample. What is the purpose? This is only designed for partial carbon dioxide and blood pH measurements. Period. Wala na pong iba. Next thing that we have to remember, this is only for newborns and infants. Wala na pong ibang pasyente. Next question. So what is the preferred site of collection, ma'am? Newborns and infants, earlobe. Ma'am, is that the commonly used site? No, the commonly used is still the lateral and medial heel surface. Therefore, this is a skin punctured blood. Check. Therefore, this is a capillary blood sample. Check. So you mean, ma'am, arterialized is not a sample but a process. Correct. So what is arterialization? You have to warm the site of puncture. Guys, hindi ko sinabing warm the blood. Yung site of puncture po ang iwa-warm mo. In other words, well, the common is the lateral and medial heel surface. So you have to get a hot water, around 42-degree water, then hot water, soak a sterile towel, soak it for 3 to 5 minutes, take it, kahit nga 2 minutes lang or 1 minute, pwede na yun. Take it, squeeze it hard. You have to remove the excess water. Kung gusto mo pa rin earlobe, wrap it with warm towel. Heel surface, wrap it with warm towel 2 to 3 minutes. Then after that, asepticize the area. 1 deliberate prick, remove the first drop of blood, then collect the succeeding sample. In other words, you have to collect samples, skin punctured blood, while the site is warm. How do you explain the sample? Arterialized capillary blood. Kasi mahirap mag-draw ng arterial blood sa newborn and infant. So this is an alternate sample for partial carbon dioxide measurement only and blood pH, lateral and medial heel surface. What else? And reasons for rapid separation of blood ay syempre to prevent glycolysis. Tandaan natin, children, ha? Ideally, the serum should be separated from POC-RBC within 30 minutes after clotting and centrifugation. You have to separate the serum from POC-RBC to prevent glycolysis. Do not forget that. Mami, paano kung hindi po maiiwasan yun? I have so many patients for today. Then we have to use an anti-glycolytic tube. And what is the basic antiglycolytic tube. That is the gray top because it contains the sodium fluoride. And when you combine sodium fluoride with potassium oxalate, perfect combination because it blocks the two combinations take on black glycolysis. And actually, the sodium fluoride prevents the glycolytic enzyme enolase. Kaya mo tinawag si sodium fluoride na anti-glycolytic agent because it prevents the glycolytic enzyme enolase. Pag titignan mo ang glycolytic pathway, you check the glycolytic pathway, one of the enzymes, one of the last enzymes in the glycolytic pathway, nasa bandang baba na yan, that will completely convert the glucose to lactate and pyruvate is the